Unfortunately, sometimes as a minority, we put a negative connotation on mental health. It's almost taboo to talk about, especially men. It's not really considered masculine to talk about such things. Outcomes become negative because suppressing depression or grief or whatever the issue is really doesn't make it go away. It just shows up in different ways. Most time for men, it shows up in anger because that is a socially accepted emotion.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now. Hello, Quality Corner listeners, and welcome to the Quality Corner Show podcast. I am Brittany Boyd, Senior Manager of Pharmacy Training and Support here at PQS by Innovacer. We have historically spent our time in this space discussing quality measure performance, equip utilization, and patient health outcomes. But in today's episode, we're going to take a little bit of a detour to discuss a very important factor in patient care, mental health. July is National Minority Mental Health Awareness Month. The Quality Corner Show wanted to spend some time discussing how our listeners in the pharmacy and in other healthcare settings can positively impact patients in their respective communities that may need assistance in managing their mental health. I am pleased on today's episode to be joined by Marvin Ferguson, a pharmacist by trade, but with extensive experience in cultural awareness and differences that impact our daily lives. So without further ado, Marvin, welcome to our show. Would you like to introduce yourself?
Hello, thanks for having me. Um, uh, Marvin Ferguson, pharmacist, and community advocate. So those are the names that I go by, and those are the things that I do.
All right. Well, we're excited to have you. So thank you, Marvin. It's good for you to be here. So our standard interview format goes question and answer. But before we get started, I wanted to see if you could provide us some details about your background, your experience, and how you currently work with communities.
Sure. So as a pharmacist, I was blessed with information that maybe your everyday individual may not have. I took that clinical knowledge out the pharmacy and tried to create opportunities to support my community. So in 2018, I started a nonprofit, Let's Get Healthy Cleveland. It provides clinical programs to all communities throughout Northeast Ohio. These programs range anywhere from opioid awareness panels to yoga events to promote cardiovascular awareness and health. A year later, I started Ask a Pharmacist, a podcast that showcases local health professionals and their services to support the community. This could span from talking with dietitians all the way to gastroenterologists about gut health. And then in 2020, I started MarvLeads, consulting that provides DEI, process improvement, and leadership training. And these services are discounted for startup businesses in the community.
That is awesome. Thank you for that. That is a great list of accolades that I'm sure that many of our listeners could benefit from. And of course, what you're doing for the community leads us into our very important discussion today. Mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental health regardless of their background. However, background and identity can make access to mental health treatment much more difficult. Marvin, you've explained some great ways that you're currently reaching out to your communities to help with the variety of disease states that patients may be interacting or having to deal with. But I want to ask you, have you encountered patients in the pharmacy setting or in the community where you're serving where their mental health challenges as a minority have negatively impacted their health outcomes?
100%. Unfortunately, sometimes as a minority, we put a negative connotation on mental health. It's almost taboo to talk about, especially men. It's not really considered masculine to talk about such things. Outcomes become negative because suppressing depression or grief or whatever the issue is really doesn't make it go away. It just shows up in different ways. Most time for men, it shows up in anger because that is a socially accepted emotion.
Yeah, that's fair. That is not, it is absolutely taboo to talk about mental health in the Black community, in the minority community, just overall. That's why it's such an important topic to make sure that we are discussing. So I really thank you for that. In an effort of transparency, I'll have to share that I've shared similar experiences of not wanting to speak about how my mental health may be struggling, or how, it's so much going on and so many different things to think about that it may be challenging to simply express what you're dealing with. The National Alliance on Mental Health Illness indicated in 2021 that 1 in every 5 adults in the US experience a mental health condition. Mental health has the capability to impact a variety of areas in a person's life and their medical conditions. Marvin, do you have any examples from your experience where you were able to provide like a custom care plan or suggest some form of holistic approach that may positively impact a patient's health?
Great question. So as I alluded to earlier, half the battle sometimes is just having the conversation about mental health opportunities. After having the conversation, possibly getting a therapist involved to talk through some of these challenges. I look at mental health opportunities like physical health opportunities. You get a personal trainer to get physical health goals, lose some weight, or meet some goals that you may have. Same thing with a therapist. Mental health goals can be the same scenario. Uh, Sharing this mindset with individuals has helped them maybe take the next step to talking about depression, grief, things of these sort that they may not have talked to others before in the past, and helping them actually get to that next step to possibly talk to a therapist. We sometimes think that, oh, if I talk to a therapist, I'm considered this term crazy or something's wrong with me. No, it's nothing wrong. We all have challenges, and it's okay not to be okay, because we all have challenges that we deal with on an everyday basis. So I think just having that conversation, uh, first of all, admitting that just like everybody else, there's something going on, having that conversation, maybe taking that next step to possibly involve a therapist to kind of talk through some of those things, and then provide some tools that you can utilize when those things come up.
Do you have examples of those tools? If you mind sharing some of those, I know that you mentioned going to a therapist, the physical aspect of it,
Absolutely.
training. I definitely can relate to that. But what are some of the tools that you would recommend?
Absolutely. So, to be transparent, I have my own therapist, right? Not particularly that I have anything going on. I think, like I stated, mental health, just like physical health. So, to be super transparent, I lost my aunt probably about, ooh, seems so long ago, but it wasn't, probably about 3 or 4 years ago. And so this is the first time I really understood this concept of grief. And so she actually lived in a different state. I had went to go visit her to take care of her affairs because she was not feeling well. But on that visit, went to the hospital. Soon as I got there, she passed away right in front of me. And so essentially, every time I thought of her after that, that's all I can think of being in that room and her passing away. Um, but of course, she's lived a long life. We've had experiences together. We've traveled. She was my aunt. So going to therapy, they provided tools around, hey, instead of thinking about being in that hospital room when she passed, think about some of the happy times. Think about some of the times when you guys traveled. Think about that is such a small part of the experience you had with her life, right? And it seems so easy, it seems so like common sense, but you don't normally just do that. And so it didn't happen overnight. So when I started thinking like, okay, she liked Chinese food, and if any, I'll share this story. She liked Chinese food, but as much as she liked Chinese food, she didn't understand what that green stuff was. Everybody knows like that's wasabi, and it's hot. And so before I could warn her one time I went to eat Chinese food. She stuck the whole thing in her mouth. And so, she, of course, her mouth was high, her eyes were like, you know, he's crying, and just took it out. And I'm like, I tried to tell you. So, I think about times like that. And so, because essentially when I thought about her being in a hospital bed, that brought me down a path of grief and sadness. And, when I think about that, it changes that whole perspective. So that's an example of a situation of grief. And that's an example of a tool that I've been able to utilize. So when I think about my aunt, I don't think about her last hour
Yeah.
that I saw her.
I really appreciate that transparency and thank you for those details. So, what I'm hearing from you is that a very strong tool that we could have in the community is mindset. That is probably the strongest tool that you could have. It's like you said, it's not easy. It's not a simple process, and it doesn't happen overnight. Like there's a time frame to it, and that's a unique struggle of underserved populations, like our minorities in the community. You're leveraged to food deserts. You may live in places where maybe you don't have that much access to care, or maybe it's a challenge for you to find a therapist that can best help you and make sure that you are best suited to positively impact change within yourself and within those that are surrounding you. So I really appreciate you sharing those details with us. Do you have any specific organizations or local events that our listeners should draw their attention to, or maybe get involved to try to help, these minority populations they surround themselves with?
Well, first I'll give a shout out to NAMI, which is the National Alliance on Mental Health. They have excellent resources throughout, all communities. Also, every community should have something around a ADM a board, and that's alcohol, drug addiction, and mental health services. So usually that board, they provide funds for organizations to provide these services to the community. And so that would be also a good way to kind of find out some of these organizations, because so for example, in Summit County, there's multiple organizations that the ADM Board of Summit County funds to help provide and support mental health um, services to folks that may need them. Also, there is, and my nonprofit provided this, I believe NAMI does as well. There's something called a mental health certificate. I'm not sure if you ever heard about that, but those are helpful. Essentially, that certificate is like I think it's like an 8 to 12 hour course. But with this certificate, it doesn't make you a mental health professional, but it gives you some understanding of being able to identify folks that may be having some mental health challenges. I can give you an example. Um, there was a gentleman that had shared with me that his aunt had committed suicide. And it was a big like surprise to the family because a month before she was taking these extravagant vacations, right? She was going all over the world, but essentially what they all talked amongst themselves like it was a change in behavior, right? So what happened was she was taking all these vacations because she never really did this, but she was taking all these extravagant vacations to mask depression. And if somebody would have been like, hey, are you okay? Um, I see you're going here, you're going there, you're going like, this is a little bit not like you. I mean, it's wonderful, but it just seems like this is kind of out of your normal routine. But the mental health certificate kind of helps you understand because looking from the outside, looking in, you would think hey, she's enjoying life, but it was a change in routine. And that small point is something not everybody would be able to pick out. So I would suggest as well, they have mental health certificates for adults and children. And I think that's a great opportunity because you just never know who you're going to come encounter with.
Yeah, that's a really great resource to make sure that our listeners and have access to that. And you brought up a really great point that it will look different, right? Like mental health struggles are not always, like you said, the sadness, the depression, or dealing with grief. Your level of change and behavior. Again, the mindset, right? Like you start doing things differently. That is still a challenge for your mental health. So I really thank you, Marvin, for that information and empowering us all with some insights on, the health outcomes for patients and how we can improve mental health in the healthcare industry and in the pharmacies that I know that we typically are in the ears of. And so as we get ready to wrap up here, wanted us to still have a chance to share maybe some personal commentary. I know that you've already provided some key details or just some key information about your own personal health, my mental health struggles that you may have had. So I want to share that for me, my tools and my resources is I do enjoy like reading, traveling. My team members that may be listening to this know how affectionate I am about crime shows. That's actually a mental health release for me, and still teaching extreme hip hop step. It all puts my mind at ease. So I know, Marvin, you mentioned having your therapist and the tools that you use, but do you have some other personal measures that you are willing to share that help support your mental health positively?
Sure. I try to work out every morning. I meditate and prayer. That's huge for me. So meditation and prayer helps ground me. I can tell if there's a couple days that I haven't gone without that because I'm like all over the place, right? When I meditate, it's almost like calm down. It's going to be all right. And uh, along with meditation, I practice gratitude because it's like I think sometimes we forget where we came from because we've gotten so far and we really forgot like where we came from. And I think kind of also practicing gratitude, like, hey, you know what? I'm doing all right. And that will sometimes change that Monday morning to make you feel a little bit better about going into work. Like I'm doing all right. I think I prayed for this job. I know it's getting on my nerves and it's Monday, but I think I wanted to be here, right? So that's helpful. And then also I stated I have a therapist that I see on a normal cadence. Sometimes I may not see her for a month or two or whatever the case may be, but it may be something that comes up that like, hey, you know what? Can I have a conversation with you? Like I need to kind of process through something that I may be, you know, going through, something that I may need some tools, something that I need to kind of think through. So, that's my own personal mental health well-being that I just suggest everyone try to incorporate some piece of that.
That was very helpful. Thank you, Marvin, for sharing. Well, this actually wraps us up. It brings us to the end of our podcast here. So I really appreciate you coming on and being able to learn from you and get an understanding of these different ways that we can impact, the patients in these underserved communities, the minorities in the pharmacy setting, in the healthcare setting. But are there any final thoughts that you would like to share with our listeners in regards to mental health or just overall care in the community and other things that they can take back with them today?
3 points. Have the conversation, have the conversation, have the conversation. That's where it starts. Um, eh, you know, keeping everything kind of bottled in, um, not really talking about things, um, it's definitely not going to help the situation. Have someone that you feel that someone that you can be vulnerable with. Maybe if it's not a therapist, someone that you can actually have these conversations with and get some positive feedback. Because sometimes you can't be vulnerable with everybody. I'm just gonna call that out because not everybody has the space for that. So with having the conversation, make sure you have the conversation with maybe the right person that can be supportive for you and maybe help you get to that next step if you don't feel comfortable originally going straight to a therapist.
Yeah, those are very helpful. And thank you for those closing remarks. It's been extremely helpful. Again, the National Minority Health Awareness Month is recognized here in the month of July. It is important to prioritize your mental health daily. As Marvin mentioned, the last three key takeaways are to have the conversation, have the conversation, and have the conversation. So we appreciate your time today for our quality show listeners for taking a detour with today's episode, but we look forward to our next time together. Thank you. The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.